You are listening to episode 4, What is a Nurse Practitioner?
Welcome to the Nurse Practitioner Show, brought to you by Accessible Healthcare Institute, empowering you with dynamic education and integrative healthcare. The Nurse Practitioner Show will share evidence-based practice strategies to implement translational research in the clinical setting with the goal of improving healthcare delivery and patient outcomes. Accessible Healthcare Institute strives to be an advocate for health promotion, disease prevention, improving public health, interprofessional collaboration, health policy efforts, and advanced nursing practice. Make sure to head on over to www.yourahi.org to subscribe to our newsletter and connect on social media. Let's join this episode of the Nurse Practitioner Show with your host, Dr. Rachel Silva, Nurse Practitioner.
Hi everyone, and welcome back to the Nurse Practitioner Show. I figured before we go any further with this podcast series that we should do an episode to find exactly what the role of a nurse practitioner is. And in just the few weeks that we started this podcast, we now have over 35 listeners in over 35 countries, and we also have nursing students and registered nurses who are interested in pursuing a career as a nurse practitioner. And just as a FYI, for those of you that have downloaded the show's app in either the Apple's App Store or Google's Play Store for the Android devices, you have access to additional bonus material that's provided in this episode, and it shares the American Association of Nurse Practitioner position statements. If you're not able to download the Apple or Google Android apps, and you only have access to the audio podcast version, this podcast is also available as a video on our YouTube channel, The Nurse Practitioner Show. Let's get started. So the history of nurse practitioners began with Dr. Loretta Ford, a nursing educator, and Dr. Henry Silver, a pediatrician, in 1965. They collaborated and discussed the need for more healthcare providers. Therefore, at Colorado University in 1965, they established the first nurse practitioner program. And by the time 1973 came around, there were more than 65 nurse practitioner programs in the United States. And 14 years after the first nurse practitioner program was established, there were more than 15,000 nurse practitioners in the United States. Later in 1985, that's when nurse practitioners came together to form their own national organization called the American Academy of Nurse Practitioners, or AANP, and now it's called the American Association of Nurse Practitioners. In 2000, that's when the AANP formed the Political Action Committee, also known as PAC, and this is an organization that helps to improve health policy efforts and legislative changes for healthcare and nurse practitioners. And this year, in 2014, there are more than 192,000 nurse practitioners in the United States, and 50,000 of those are AANP members. So what do you do to become a nurse practitioner? First, you have to have a Bachelor of Science in Nursing and licensed as a registered nurse. And then you would continue graduate education from a college that is accredited with either college or university that is accredited by either the CCNE or the NLNC. And that stands for the Commission of Collegiate Nursing Education and the National League for Nursing Accrediting Commission. And once a person has successfully completed either a Master of Science in Nursing or a Doctor of Nursing practice and a graduate education, they then can become eligible to take their national certification. And national certification, the organization that you would become certified through, depends upon what type nurse practitioner you are. If you are an acute care nurse practitioner, then you would take your national certification exam with either the ANCC, which is the American Nurses Credentialing Center, or the AACN, which is the American Association of Critical Care Nurses. Family nurse practitioners are certified through either the American Association of Nurse Practitioners or the ANCC, or the American Nurses Credentialing Center. Neonatal nurse practitioners, they're certified through the National Certification Corporation. And pediatric nurse practitioners, they are certified through either the ANCC, which is, again, the American Nurses Credentialing Center, or the Pediatric Nurse Certification Board. Psychiatric mental health nurse practitioners are certified through the ANCC, and women's health nurse practitioners are certified through the same board as the neonatal nurse practitioners, the NCC, or the National Certification Corporation. Once you're certified, you then can apply to your state board of nursing to receive licensure as a nurse practitioner to begin practice and working as a nurse practitioner. And nurse practitioners are licensed as independent healthcare providers, and they are individually responsible for the specific care that they provide. Now, state licensure is different depending upon which state you are located in, and that's why I've also included a graphic from the American Association of Nurse Practitioners that's available on their website, in which it shows the differences with each state, whether it's green, yellow, or red, and the different state practice acts that they have that reflects the type of licensure and regulations and the practice that they're capable of within that state. So therefore, the state licensure is dependent upon each state's regulations and their own application process. So you would need to consult with your own state board of nursing. So what exactly can nurse practitioners do? The nurse practitioner provides care along a wellness-illness continuum, and it is a dynamic process in which they provide direct primary and acute care across different settings. And they're members of the healthcare delivery system. Nurse practitioners practice autonomously in areas that are very diverse, such as family practice, pediatrics, internal medicine, geriatrics, and women's health care. And during their education, nurse practitioners are prepared to diagnose and treat patients with undifferentiated symptoms, as well as those with established diagnosis. And both the primary and acute care nurse practitioners provide is initial, ongoing, and comprehensive care. They are able to take comprehensive histories, provide physical examinations, which includes annual physicals, and other health assessment and screening activities. Nurse practitioners diagnose, treat, and manage patients with acute, episodic, and chronic illnesses and diseases. And this includes nurse practitioners ordering, performing, supervising, and interpreting laboratory and imaging studies. Nurse practitioners prescribe medications and durable medical equipment. Nurse practitioners' care includes health promotion, disease prevention, health education, along with the management of the acute and chronic diseases. And they are prepared to practice as primary care nurse practitioners and acute care nurse practitioners. Nurse practitioners evaluate the patient outcomes and collaborate with other healthcare providers as needed. So nurse practitioners are healthcare providers that give quality healthcare services as primary healthcare providers, acute healthcare providers, and as specialty healthcare providers. And although nurse practitioners diagnose and manage both acute and chronic health conditions, the focus for nurse practitioners is treating the patient as a whole and providing holistic care with health promotion and disease prevention, because nurse practitioners promote a wellness versus solely treating illness, and is the primary goal of nurse practitioners. The nurse practitioners are licensed, independent healthcare practitioners who function autonomously in either inpatient or outpatient settings as primary care providers and or specialty care providers. The Institute of Medicine put out literature regarding the future of nursing and leading change, advancing health. And it's a document that nurse practitioners, in which they state nurse practitioners should be utilized to the full extent of their education and training and be full partners with physicians and other healthcare professionals. So the role of nurse practitioners was also discussed on C-SPAN with Dr. Susan Apold.
Washington Journal continues.
And now on your screen is Susan Apold. She is a member of the board of the American Association of Nurse Practitioners. Ms. Apold, what's a nurse practitioner?
Nurse practitioner is a registered nurse who has advanced education and training beyond a baccalaureate degree in nursing. Nurse practitioners can diagnose, treat, and prescribe patients, much like the public is familiar with physician prescription diagnosis and treatment. However, we also bring a nursing model to the patient care situation.
What does that mean?
It means we're nurses first. And so as registered nurses, we are taught to take care of the whole patient, to make sure this patient is at the center of our care, to take into consideration their socioeconomic background, their family background, their perceptions of illness, their knowledge level about health and illness. And then, as nurse practitioners, we bring an extra level of care in that we have advanced education and training that allows us to diagnose, treat, and prescribe for our patients.
How much schooling goes into being a nurse practitioner?
Nurse practitioners must have a bachelor's degree in nursing.
4 years.
4 years. Then we also must have a master's degree in nursing. And there is a growing trend for nurse practitioners to have a doctorate of nursing practice in nursing.
And you are a doctorate of nursing, correct?
No, I actually have a PhD in nursing.
A PhD, and that's different than a doctorate in nursing.
It's different than a doctor of nursing practice degree. So let's try to clear this up. A PhD is an academic research degree. It's been around for a very, very long time. The doctorate of nursing practice degree, that individual is prepared differently in that is a practice doctorate. So those folks will have additional clinical education and clinical practice experience.
There has been some research that has documented the outcomes of the care that nurse practitioners provide. In 2010, it was estimated that there were over 624,000 practicing physicians in the United States. However, less than 33% of those were primary care providers. This is according to the Agency for Healthcare Research and Quality. And these numbers are expected to decline as fewer medical students choose to enter primary care specialties. There's been numerous individual and comparison studies, as well as meta-analysis that has demonstrated that the quality of nurse practitioner care is comparable to, and in some cases better, than the care provided by physicians. These results were indicated in 10 studies that the care that nurse practitioners provided was equivalent, and in 12 studies it indicated that nurse practitioner care was better in comparison. And similar studies have also shown that the cost for similar services are generally less when provided by nurse practitioners. So nurse practitioners, with their education, they are prepared to be change agents to advance health and lead change in the healthcare system. And by doing this, nurse practitioners increase the access of healthcare for patients and also contribute to the quality of healthcare and decrease the cost of healthcare. The Institute of Medicine, with the future of nurse practitioners need to become active members of their state and national nurse practitioner organizations in order to help fulfill the role that the Institute of Medicine desires for nursing and nurse practitioners. And active participation will contribute to the much needed legislative changes and health policy to support the Institute of Medicine's Future of Nursing initiatives. And these initiatives include removing scope of practice barriers for nurse practitioners to practice to the full extent of their education and training, to expand opportunities for nurses to lead and diffuse collaborative improvement efforts, and build an infrastructure for the collection and analysis of interprofessional healthcare workforce data. And this concludes episode 4. I want to thank each of you for subscribing. Please leave your review in Apple iTunes because that helps to alert Apple of the continued support that we have for the show. And show notes for this episode of the Nurse Practitioner Show are available within our Apple and Android apps, as well as on our website, thenpshow.com. And there you'll also find ways to connect with us on social media. We would love to hear from you. You can email us at thenpshow@gmail.com. You can call our hotline number at 212-726-2979, or you can leave a voice message via your computer on our SpeakPipe page, which is on the website. And you never know, we may just broadcast your message, so stay tuned.
Thank you for listening to this episode of the Nurse Practitioner Show. Be sure to subscribe to our podcast to receive future episodes. Then head on over to our website at www.yourahi.org and connect with us on social media. See you there!